Thank you very much. So I'm Helen Morton, I'm from Newcastle in the UK, so we're comparing a couple of symptom scores in men in quite a normal cohort of patients. They're my disclosures. So as we're aware, we really should be using some validated symptom scores in patients, both in that initial workup period as well as in looking at patients' progress through treatment and surgical options, that we can actually evaluate their response to treatment. And that's a statement which is supported by the EAU guidelines for non-neurogenic male lower urinary tract symptoms. There's a number of different scores available. And two of the more common ones are the IPSS, which we are all very familiar with, which has 7 questions on core symptoms and a single quality of life parameter. Whereas the Iciq Mluts has a number of different domains which are assessed over a further period of questions. So there's 23 questions involved, and each of the questions tend to have their own individualised bother score, which means that we can actually look at how specific symptoms are affecting patients. And there's also some pictorial representation as well as text. So we looked at the 2 questionnaires in a typical cohort of patients, which was men over the age of 18. These are men who have voiding lower urinary tract symptoms as a predominant, and also who've been referred for urodynamics in our unit with a query regarding bladder outlet obstruction, and we did not look at neurogenic patients. So 45 men were included. They had a mean age of 66 years and 100% completed both questionnaires, so we had full response. The mean IPSS score was 20.4, putting them in a moderately symptomatic group, and the mean Iciq Mluts score was 33.7. We looked at these scores as a function of their total score for that questionnaire, since obviously they're different scales, and that was a total of 58.3% for the IPSS and 40.1% for the Iciq, so certainly patients appear to be scoring lower on that questionnaire compared to the IPSS. But there was a strong positive correlation demonstrated for the 2 scores, so the Spearman coefficient was 0.62. And all comparable domains, so the 7 questions from the IPSS, exhibited either a moderate or strong positive correlation, which were all statistically significant. So when we break these symptoms down into categories, so storage symptoms, voiding symptoms, and post-micturition symptoms, we can look at how they're comparing between the 2 questionnaires. And so whilst the voiding symptoms exhibited very similar percentage of the total available score, 58.7 to 56.3, there was a difference with both the storage symptoms and the post-micturition symptoms. As I'd mentioned at the start, there are a number of additional questions on the Iciq Mluts, and in our population of patients, we had actually quite a significant predominance of terminal dribbling, hesitancy, and the repeated need to void within 15 minutes. So 88.9% of our patients had these symptoms, and these symptoms wouldn't have been picked up with the IPSS score on its own. We also had a 64.4% rate of urge urinary incontinence, and IPSS doesn't talk about incontinence at all. So in conclusion, there are some very prevalent symptoms in this cohort which are missed with the IPSS questionnaire, but there does need to be a trade-off between how well and completely we're assessing patients and their symptoms versus the important factor for patients, one of which is how easy it is to complete these questionnaires. And obviously we've heard a lot about health illiteracy during this conference, and we need to make sure we're not excluding patients or giving them disadvantages with regards to how we're assessing them. There's not currently a gold standard, but we would suggest that potentially this tool is better for a fuller evaluation of patients with LUTS, and the fact that it has a bother score per symptoms, where you can look at actually just the significant symptoms for a patient and have a very patient-centred, individualised treatment plan. Thank you.
I can't begin to underline the importance of what you've just said. It's fundamentally correct. But you've done a correlation of post-micturition scores. IPSS doesn't really have a post-micturition score.
Yeah,
what were you deriving there?
So I debated this with Chris Harding. Well, this is part of some other work which we're doing with a few projects in the department. So we mainly looked at which parameter was it? I can't remember off the top of my head. Yes. Yeah, exactly. It's a single question. It's not really, you can't really look at the data on that and say, but storage and voiding, certainly. I'd originally just put storage and voiding. He was like, oh no, think about post-micturition on that as well.
Yeah, lovely work. We were doing something similar in Leeds when we introduced one-stop Lutz clinics. We found it combative trying to get patients to complete longer questionnaires. Did you do any satisfaction scores with patients as to how they felt about filling out reams of paperwork?
We didn't do satisfaction scores, but obviously looking at patients, some patients would say, "Oh, I wasn't sure about that question," and they might have clarified things with us for the ICIQ Mluts, whereas that didn't tend to happen with the IPSS. And it very much varied between, certainly a lot of older, frailer patients found it more of a struggle to do the longer questionnaire.
Question similar in the sense of you're interested in patient satisfaction, but did you just ask the patient what they preferred?
We haven't yet. There's still work ongoing, and that certainly can be something which we do. We were mainly looking at the way in which it's picking specific symptoms up rather than, whether the patient prefers one or the other.
And did you look at the time to completion? Because ultimately the patients do get questionnaire fatigue, and the more wordy they are, the Mluts is a great questionnaire, but it's often pretty difficult for people.
Yeah, it definitely obviously will take longer to complete. Obviously, that depends on what it's a part of elsewise. If they're having lots of other investigations, then you want to try and minimise the amount of time. But if you're just doing one questionnaire, then, if you want to pick up further symptoms, then it might be better.
Okay, very short one, Kari.
Hi, Kari.
Thanks, Helen, for your work. Everybody, I hope here agrees, like post-micturition dressing dribble, incontinence, bother, not captured by IPSS. Yeah. You should not only use that. We use Danish prosthetic symptom score in Scandinavia. I think it's equally good as Iciq Mluts because it covers both those. How much did it take time to do these two? What was the time difference?
So the patients, we didn't see them fill in the IPSS in terms of time. They filled in that, it got sent out with all of their initial paperwork, so they filled that in before they came to clinic, and then were given the Iciq Mluts whilst they were in the waiting room. So we don't have that comparator, but it's definitely something that could be looked at.
Okay. Thank you very much.
Great. Thank you.
Thanks.